Hey everyone, this is Dr. Jamie LaViola with Dental Masters of Alexandria, and we're here to welcome you with another episode of Ask Dr. J. Today's topic is there any truth to the fact that breathing through your nose is better than breathing through your mouth? Well, let's go ahead and talk about it. So nasal breathing is 100% better than mouth breathing, and here are some of the whys and some of the benefits. So first, as air comes in through your nose, it's going to have a filtration effect. There's nasal hairs as well as something called cilia, which are microscopic hair-like projections that are going to filter out dust, pathogens, very often can prevent you from getting sick. On top of that, when you breathe through your nose, it's going to make the air more humid and more warm, so as that comes into your lungs, you exchange the oxygen smoothly and more comfortably. More oxygen. So when you breathe through your nose, it releases something called nitric oxide, which increases carbon dioxide in your bloodstream, which in turn releases oxygen. Mouth breathing doesn't release nitric oxide as effectively, so your cells may not get as much oxygen when you're breathing through your mouth as opposed to breathing through your nose. Next up is heart rate and blood pressure. So nasal breathing often will maintain a smoother, better heart rate. This is why during exercise it's suggested to breathe in through your nose and out your mouth to get a rhythm. It helps to prevent spikes in the heart rate up and down, which will decrease endurance and fatigue. Blood pressure, nasal breathing will often lower your diastolic blood pressure, and it creates a shift in your nervous system to what we call the parasympathetic state. Parasympathetic, just think of rest and digest, calm, and sympathetic would be fight or flight, and that's more aggressive, more ready to go. So this gives you a more relaxed state by nasal breathing. Again, why often when you are meditating or doing exercises, it's always breathe in through your nose. Next up is pH balance. pH balance. Mouth breathing can cause your body to lose too much carbon dioxide, which can change your body's natural pH levels. This can lead to dizziness, lightheadedness, or even fainting if it's not checked. This is also similar to if you've heard of hyperventilation, where you are taking very fast breaths in and out of your mouth and you're losing too much carbon dioxide, changing that pH state. That's why hyperventilation, you can have lightheadedness and or fainting if it's not checked. Next up is diaphragm recruitment. That's that large dome-shaped muscle that is underneath your heart and lungs and separates your abdomen from your upper chest. And as you breathe through your nose, it's going to stimulate the diaphragm, which will also then stimulate the vagus nerve, which can have a calming effect on your mind. And again, this is why when you see certain types of breathing exercises, meditation, it's almost always long, slow breaths in your nose. Use your diaphragm and give you that calming effect from nasal breathing. So clearly, nasal breathing is better than mouth breathing, and the evidence is there to support it. And there's two times we have to think about this, right? When you're awake and when you're asleep. One of them you can control a little bit more. So when you're awake, the recommendation that I have is definitely to try to do some type of breathing exercises or meditation. I'm incorporating this in my life. And when you're exercising, especially your cardio, really try to focus on breathe in your nose and out your mouth. And as you develop that pattern, it becomes easier to do. So we talked about nasal breathing during the daytime, and you may be saying, well, what can I do to improve my nasal breathing at nighttime? Or is there anything I can do to enhance that when you have the least amount of control when you're sleeping? Well, a matter of fact, there is some things that will help you with this. So first that we see, and if you Google it, probably will come up, it's mouth taping. And this is covering your mouth with a micropore tape to encourage nasal breathing or develop the habit of nasal breathing. So I do want to throw this out there with a lot of caution, as there's only anecdotal evidence that shows that this is helpful, not enough scientific evidence to support it. So if you are going to proceed with mouth taping, I would get a consultation or work with your physician, sleep doctor, to make sure it's appropriate for you, because there's definitely people that have gotten better with mouth taping and enhanced their nasal breathing while sleeping. So there are some things you can do. First up would be elevate your head. You can either use pillows or an adjustable bed base if you have one to raise your head and upper back. This helps to open up airways, prevent mucus from plugging your nose, and overall gives you a better chance of breathing through your nose as opposed to your mouth. Use of nasal spray or decongestant. So there's saline sprays, there's things called neti pots, which allow you to flush your nose or nasal passages with saline water, and or allergy medication. If you're someone that has nasal pressure because you maybe have allergies or blockage, these ways are a healthy way, especially the neti pot and saline sprays, to clean your nasal passages, open them up so you can have better airflow. Sleeping on your side. This can be a better way to sleep than laying flat on your back. It helps to prevent your tongue from falling back and blocking your airway. Treating your allergies. This goes somewhere along with what we talked about with using nasal sprays or decongestants, but if you're somebody that has allergies, it's important that you treat them. Maybe go to an ENT or your primary care and find a way to treat your allergies so that your airway and your passages are clear to allow for more nasal breathing. And an easy one is keep your house clean. Basically, make sure you're changing your filters in your HVAC system, that you're dusting. Those dust particles definitely can be an irritant, especially when you lay down to sleep and everything settles. Okay, to sum it all up, nasal breathing is the way you want to go. Thanks for tuning in to another episode of Ask Dr. J.